Today we're going to talk a little bit about our long-term plans for COVID-19 testing here in Massachusetts and some new announcements to make testing more accessible for people. And we'll also talk about some significant shipments of personal protective equipment that have recently arrived in Massachusetts, thanks to some very hard work by members of our team and many others. But first, we'll provide our daily update on testing cases and hospitalizations. As of yesterday, we've conducted over 410,000 tests, with over 8,500 new tests reported yesterday. There were 1,165 new positive tests reported, which represents a 14% positive test rate for all tests that came back yesterday, and that's certainly within the range we've been seeing over the past few days. And as we've said before, that positive rate has come down significantly from where we were a month ago, where the percent of positive tests was hovering in the 20s and the 30s. We saw 26 fewer hospitalizations for COVID-19 yesterday, but we still have over 3,000 residents in the hospital due to COVID-19 that are in need of serious medical care. But fortunately, our hospitals have been able to withstand the surge and continue to be able to care for everyone who is seeking medical attention. Massachusetts, however, still remains one of the hardest hit states, and while many data points have been declining, which is a hugely positive development for which the people of Massachusetts deserve enormous credit, we're watching these numbers very closely because they do move day to day. Another number we report on daily is our distribution of personal protective equipment, and as of yesterday, we've distributed around 10.5 million pieces of PPE, having never distributed a single piece of PPE 65 days ago. There's a lot of work that goes into getting frontline workers the PPE that they need, and in a few minutes I'll talk about the significant effort our administration and many others have put forth to procure several large shipments. But first, I do want to talk a little bit about our plans to continue and ramp up testing. With over 410,000 tests conducted to date, Massachusetts is currently a top 5 testing site per capita, and we're going to continue to expand our capacity where we can. As I said yesterday, Massachusetts currently has the lab capacity to process about 30,000 tests per day, and labs are continuing to utilize test processing for about 10,000 or 12,000 tests per day. That's good progress, but we need to do more. Earlier today, CVS announced the launch of 10 new COVID-19 drive-through testing sites at CVS locations across Massachusetts. CVS has been an early partner in the Commonwealth's work to expand testing, launching drive-through test sites as we were beginning to ramp up our testing process. These new sites are part of CVS's first rollout of its national testing expansion program, which is starting in just a handful of states. The 10 drive-through sites will be at CVS locations in Charlton, Worcester, Raynham, Northampton, Bridgewater, Carver, West Springfield, Danvers, Westport, and Wellesley. Individuals who meet testing criteria will be able to register in advance at cvs.com starting tomorrow to schedule an appointment. Patients will be required to stay in their cars and directed to the pharmacy drive-through window, where they will be provided with a self-swab test kit and given instructions. Tests will then be sent to a lab for processing, and results will be available in approximately 2 or 3 days. In addition to these new accessible sites, we're also expanding testing in our community health centers. Last week, we expanded our testing partnership with Quest Diagnostics and 18 community health centers throughout the state. As of today, Quest has shipped out more than 20,000 tests to community health centers throughout Massachusetts. We're grateful to CVS and Quest and to our community health centers for their continued partnership on expanding testing across the Commonwealth. And as we've made more testing available and accessible, we're also planning for the future of COVID-19 testing in Massachusetts. Important groundwork has been laid to expand lab capacity and testing infrastructure. Now we need to build on that foundation as we continue to fight the virus for the long term. The federal COVID-19 legislation that was passed by Congress on April 24th includes testing resources for states. To access these funds, states must submit plans to the federal government outlining their testing strategy. We plan to submit our plan later this month. It will ensure that we can do even more, especially as we begin the reopening process. But many pieces of this will need to be signed off on and supported by the feds. The plan calls for boosting overall capacity to 45,000 tests per day by the end of July. That would be over 16 million tests a year, and 75,000 tests per day by the end of December. That would be over 27 million tests per year, with the goal of decreasing our positive test rate over time to less than 5%. We also plan to help labs expand their processing capacity, in part to prepare for a potential surge in testing in the fall. We also plan to make sure that we have testing capacity to test workers who are often found in regular contact with COVID-19 patients, positive patients, as we go forward. The state will continue to expand our testing for residents and patients in high-risk congregate settings like state hospitals, group homes, and correctional facilities as well. And we'll set guidelines to offer testing for individuals who are symptomatic or who are close contacts of confirmed COVID-19 cases or whose employment places them at high risk. We also want to support randomized testing for surveillance purposes, which will be built on the work being done by the Community Tracing Collaborative to track the virus and understand what communities are seeing infections. The plan also calls for faster turnaround times on tests so healthcare providers can make same-day or next-day decisions based on results. In implementing the new testing that's part of this plan, we'll focus particularly on communities with low testing availability, hotspots where we're seeing high positive rates, and high-density areas. In order to meet these goals, we will need support from the federal government, but thankfully the CARES Act offers a funding mechanism and a program model for states to apply through, and they plan to have the results back within 30 days. Expanding testing is critical to opening workplaces and businesses. I think we all know that. Our testing plan will improve our ability to rapidly identify new cases of COVID-19 so individuals can quickly isolate, seek treatment, and limit their exposures to others at home or at work. This week, the Department of Public Health expanded testing criteria to include both symptomatic individuals and close contacts of confirmed cases. And while that's a significant testing expansion, we're not pursuing universal testing for every person because our healthcare experts agree that testing does have its limitations and should be more strategically applied. This expanded but targeted approach is both attainable and recommended by our medical experts. There's no path currently to achieving what many refer to as universal testing, which has its own limitations and is frankly too far off to rely on for our reopening. It's a valuable tool, testing, but it's not the only tool that we have to fight back against the virus as we begin to phase in our reopening of the economy. That's why the mandatory workplace standards that we released this week have a heavy focus on things like social distancing, hygiene, face coverings, and disinfecting. Employees who exhibit any sign of illness at work should obviously go home. And employers must implement flexible policies so employees who do test positive for COVID-19 or who are identified as a close contact stay home and work remotely if they can. It's critical that employers implement these workplace standards to be prepared for a possible COVID-19 outbreak in their own facility. A single positive case or symptomatic worker could result in a significant number of employees being quarantined at home or testing positive. We'll have more to say about the role of employers and the role that they must play as we go forward. But it's important to remember that we need every tool at our disposal, and that includes more testing, face coverings, and responsible workplace practices to keep people safe. Next, I want to share an update on some of the work our administration and others have done to secure significant amounts of personal protective equipment for frontline workers. There are a lot of moving parts associated with efforts to get PPE here, and there have been some challenges in the past with securing and finalizing the shipments that we've procured. The process is made much more complicated by the fact that much of the equipment that we're seeking is not made in the United States and certainly not at the volume that we need. Our administration has been working to source, procure, and transport PPE from manufacturers in China. The collaborative approach between our administration, the crafts, and many others to bring respirator masks from China on the New England Patriots plane is reflective of the significant and complicated effort it takes to get this valuable equipment to Massachusetts. Over the past few weeks, our administration has been working with several partners and Chinese officials to purchase and ensure the delivery of over 7.5 million pieces of PPE and supplies. This equipment was flown to Massachusetts on 6 different chartered flights, which have been landing in Boston from April 20th through last weekend. Masks make up the vast majority of the equipment, totaling over 6 million surgical and procedural masks. The shipments also include about 800,000 swabs, nearly 400,000 coveralls, and over 125,000 gowns. Once the shipments arrive, our administration works through MEMA, the state police, the National Guard, and the Department of Public Health to inspect, warehouse, test, and then distribute PPE to the entities who need it. These shipments are a big win for Massachusetts and for the folks working on the front lines who need this very important equipment as they risk exposure to COVID-19 every day. And we're grateful for the wide range of partners who have helped make it happen, starting with the Chinese Consul General in New York, Wan Ping. Last month, I reached out to Ambassador Wan and asked for his assistance. We're grateful for everything he and our partners did to facilitate these shipments. In addition, we had help on the sourcing and procurement side from the global infrastructure partners, and specifically JP's son and former World Bank President Jim Kim, who's also been instrumental in helping formulate our contact tracing initiative with Partners in Health. The Chinese firm Ningbo Small also performed crucial work around sourcing and procurement, especially on the ground in China. Additionally, a number of other partners played key roles on transportation and logistics. Ocean Air, a Boston-based company specializing in supply chain logistics, helped secure these crucial flights, and Delta Airlines allowed for use of their hangar at Logan Airport, where the equipment was sorted and prepared for distribution by the National Guard. I'm also grateful to the efforts of our team here in the Commonwealth, which are led by Gary Lambert, who's our Assistant Secretary for Operational Services. He led a team that included our office, Massport, MEMA, and our partners from McKinsey who've been working with the command center. This included nightly check-in calls with the team on the ground in China as we work to move this equipment through the process. And finally, I want to thank our Chief of Staff, Kristen Lepori. She's done a tremendous job leading this effort and coordinating an incredible amount of moving parts to land these planes with the supplies that people need. These shipments from China are adding significantly to our inventory, and we also continue to work a variety of channels to procure equipment wherever we can. Pleased to say that today, Steward Healthcare also announced that they're donating 50,000 isolation gowns to the Commonwealth, and those gowns will be distributed to communities like Taunton, Brockton, Dorchester, and Mattapan, and Methuen. We're also grateful to Steward for this partnership and their ability to bring this much-needed equipment to the front lines. Let me close with this. This initiative was laid out. The initiatives that we laid out today are crucial to our efforts to continue to fight the virus. But they also lay the groundwork for a successful reopening of our economy on a phased-in basis. Implementing our long-term testing strategy will be critical to keeping people safe even as we start to open things back up. And our work to sustain our supply of PPE is crucial because that equipment is going to become even more important as people begin to return to work and need to keep themselves safe. We're pursuing what we would call a responsible approach to this. Our top priority is fighting the virus as we return to something like a new normal. And with the steps we're continuing to take on these and other issues, we're ensuring that we're well positioned to reopen without giving up all the important progress that you and we have made so far. None of the information I shared with you today would be possible without the hard work, creativity, and determination of our residents and many others. From our staff here in the Governor's office, the command center, to the men and women of our National Guard and everyone else who's given 100% to serve the residents of this great state. 7 days a week, meeting every challenge in our path, we'll continue to keep fighting the virus and to make Massachusetts safe as we work to get you all back to a new normal.